So now, without further ado, I'd like to introduce our panelists. Our panelists will be joining me for today's conversation. First is Ken Duckworth, Dr. Ken Duckworth, Senior Medical Director for Behavioral Health at Blue Cross Blue Shield of Massachusetts. Welcome, Ken.
Good morning.
Hi, Allison Lilly, Director of Employee Assistance Programs at Mass General Brigham. Welcome, Allison. Keith Marion, as you just met, Head of Corporate Diversity, Equity, and Inclusion for Harvard Pilgrim. Nikki Salcido, Vice President of Client Strategy for Optum Behavioral Health, United Health Group. And Terry Weber, Partner at Spring Consulting, a consulting group that works with healthcare organizations and companies throughout the Commonwealth. So I think we've got everybody on screen here. There we go. So welcome, everyone. Thanks so much for joining me today. And we're just really excited to have you all here to have this great conversation. So we hope, as I said to you earlier, we're going to just have a really nice free-flowing discussion. So all my job is to manage the conversation so we can hear from everyone. So, I'd like to just start out really with a general question. And let's see, I think I'll direct it to Allison first and then have the rest of you join in just to give a place to start. So mental health obviously is an issue that has always been probably difficult personally and professionally for people in their lives, and particularly in their work lives to talk about. So what are some of the key challenges in addressing the topic of mental health in the workplace? And Allison, why don't you kind of kick it off for us?
Sure. I think what comes to mind with one of the key challenges is stigma. And I think it's really hard for people to acknowledge that they have a concern. And I know in the employee assistance program, and we serve all the Mass General Brigham system, is we start at orientation, letting our employees know that the EAP is here, not just for behavioral health, but also for work-life resources, for childcare, for elder care, and trying to break down some of those barriers related to the stigma. I also think that with COVID-19, it's been one of the positive things in terms of everyone's acknowledging their loneliness or their isolation. And I think that has, helped in terms of all of us being able to acknowledge if we're struggling some and might need some behavioral health support. So I think that has been one of the benefits.
The stigma is really, really important. And that's something I think that we'll find weaves throughout this conversation today. But Nikki, maybe I'll jump to you. What do you see as some of the key challenges, other key challenges in addressing the topic of mental health and its associated things in the workplace?
After stigma, it's demystifying the healthcare system. It is encouraging people and empowering them to seek help when they need it, making it easier to navigate to resources. So we talk about stigma that prevents people from seeking care, but what are other barriers out there that we can remove to help people feel more comfortable, even acknowledging their appropriate care path? Sometimes the stigma is, I shouldn't take medicine, and maybe you should, and maybe you should see a clinician. So we want people to take down the barriers at every step of their behavioral health journey. That will help us get to the best outcomes.
Absolutely. Ken, any thoughts on that?
Yeah, Carolyn, my take on this is during the pandemic, mental health went from a they thing to a we thing because so many people have been impacted. The CDC demonstrated in a very comprehensive survey that about 42% of Americans were having clinically significant mental health symptoms, anxiety, depression, trauma, and relapse of addiction. That was done last June, and I can't imagine that the continued isolation, job loss, racial trauma, that has continued through this period of time has made things better. And so to me, the silver lining of this pandemic is people are willing to talk about it in a new way. And I see this from employers too. They want to talk about it. How can they attend to their employees? What do they need to do about their culture, their benefit structure, their co-pays? This is a conversation that I didn't really feel 5 years ago. And I think, like many difficult things, there are occasionally silver linings. And I think this is one of the aspects of the pandemic that will stay with people. People are unlikely to snap back. We know from the data on prior experiences of collective trauma that people continue to have symptoms and experiences in an ongoing way.
Absolutely. Terry, I see you shaking your head.
I liked that expression, people are unlikely to snap back. I think everyone's resiliency is going to be really different. Some people are still mourning someone they lost that they weren't able to bury, a year ago. And so, people's ability to snap back is going to be extremely different based on how this pandemic has really impacted them. So I liked that term. I'm going to steal that, Ken. But I agree with, my colleagues on the panel. I think, stigma and access or navigation, as Nikki was talking about, are really important. I also think cost is still an issue for us, whether it's because access is an issue that then it leads to more out-of-pocket costs, or a certain demographic of the population, maybe our low-wage earners, maybe our younger folks that might have additional out-of-pocket costs for behavioral health. So I see that as one additional thing to add to the list as well.
And whenever you talk about health in general, as much as we want to have care for all, cost can always present a challenge. Keith, anything to add to that about just the key challenges in addressing this topic at work?
Yeah, I'll just add quickly that when we're thinking about employers and organizations, typically you see shying away from this conversation, shying away from talking about mental health in the workplace. What I've seen over the last year plus is a shift from that. And I think that that's a great thing. Although we're living in an environment that is very tenuous, I think that what it's also caused is organizations to connect more with bringing mental health discussions into the workplace. In the past, it has been taboo, right? People didn't want to feel as if they are out of control, can't do their job. So they had fear around talking about mental health in the workplace. And I think this new environment, as Ken mentioned, it's more about we now. And that has been a shift that I have, although in a bad situation, in a bad environment, I think has been a good awakening for us and an acknowledgement of the importance of mental health.
Yeah, I really like Ken's expression. It's shifted from a they to a we, because I think that speaks, I think, collectively to the fact that if we can talk about this topic more, because no matter what, everyone has had an impact. We can look at it as, work together, and as I think employers, that they sort of stand with their employees in terms of, we can help you work through this, for sure. So this is just going to really to extend on the topic a little bit, but and I think you've talked about it already, but maybe we can delve into it a little bit more. How has COVID, this pandemic, made it easier in some ways to talk about mental health, which we've talked about, but how has it made it harder too? So how has it made it harder or easier to sort of bring up that topic of mental health? Anyone want to start with that?
So I'll jump in on the harder side, given that we're all, most of us are working remotely, and not having that opportunity for personal connection. One of the things that we at Harvard Pilgrim Healthcare Tufts Health Plan, we focus on building community. We focus on opportunities for folks to come together and have discussions. You might think about this in terms of safe spaces where folks can seek therapeutic care through conversation with one another. And we call these healthy conversations. And not having that opportunity to see people in spaces, see body language, have those personal interpersonal connections, has been a barrier for folks, I think. And we all, I think we could all agree that that's important. That whole social context and being able to connect with people helps us with our mental health, and not having that could be a problem.
Great. Other comments on that? What's made it harder or easier? How has COVID impacted that?
Carolyn, one of my takes on this is demand was beating supply. For COVID in the mental health and addiction space, demand is now crushing supply. And I think that we have to think creatively about bringing other strategies, resources. One of the things that our CEO, Andrew Dreyfus, did was allow people to use their sick days as wellness days. This is a policy decision that any employer can make in acknowledgement of what is happening in the pandemic. We've tried to create resources to make it easy for people to find care, but I think it's really important to recognize that even with an in-source team that is willing to walk right beside you, the mental health system is decentralized, fragmented, and confusing for people. And I think it's just important to acknowledge that you have to build capacity in the primary care side. We're hoping to support peer recovery coaches once there's a certification process for that. And I've been working with my colleagues at HR at Blue Cross, running mental health chats. We do it every other week. I thought we were going to do it for 6 weeks back when we were, quote, bending the curve. And what I encourage in these conversations is for people to learn from each other.
Mm-hmm.
It's not all mental health, mental illness. It's a lot of coping, resilient strategies, staying connected, learning from each other. You know, I've been to the American Psychiatric Association conference for 25 years. There's never been a day when I went to a pandemic mental health class. And this is my pandemic too, is what I tell everybody. So we're in a collective engagement strategy. How do we learn from each other? How do we create a culture where it's okay to seek help? It's okay to support each other. It's okay to ask questions.
Great question. Anyone want to comment on that? How do we create that culture? Terry, Allison, Nikki?
I'm not sure I have a great solution for breaking that culture. But I think going back to the original question, I think one thing that's made it easier to look at kind of the positive side of the coin is we're at least having these discussions, I think, more commonly. I think we're less concerned about using the air quotes kind of right terminology. Mm-hmm. I've sat in rooms where people, you know, debated behavioral health, mental fitness, resiliency. And we spent a lot of time and energy maybe figuring out the right terms as opposed to moving past that and realizing, well, we might not have the exact right term for everybody, but the key is to get them the resources. So I think that's been one positive thing with the pandemic. I agree with things that have been said, you know, the disparity, the capacity, all of that is definitely a challenge. But one other positive, I think, is employers and health plans have embraced, out of necessity, you know, anything that can be technology driven. And we're seeing a lot of new entrants in the market or entrants that have been kind of on the wings that are now coming center stage to give more of a virtual solution. And I definitely do not think that virtual solutions take the place of the need for face-to-face. But I think for a lot of people, especially folks looking to really build up the coping and resiliency, they're a wonderful solution. And I think a lot of the virtual solutions can also help with the issues we started at the beginning, you know, less stigma about asking for time off, needing to be away, being able to do it in the comfort of your home, easier access, and a lot of times, you know, less expensive options as well. So certainly not a full replacement, but definitely I think an opportunity that we've embraced partially because of COVID.
Yeah. Any other? Allison, yes.
Jumping off of what Terry's saying, and I don't think, Ken, it was really creative. It was a necessity of the telehealth. So in the EAP, everything became telehealth. We went off site, but then came back on. And still, we don't have as many employees coming face to face, and we're healthcare, right? So I think that the telehealth has really opened up a world of opportunity for people to get the care that they need. That being said, you know, we look at our data in EAP and we see an increase, obviously, of anxiety, to no surprise to anyone, and depression. We also see that more in higher rates in the population that we're seeing in the Latinx population and our BIPOC employees as a whole. And so, you know, and some of their concerns are more social determinants of health than behavioral health. So like we try to balance, how do we help with those needs while we also know that there are behavioral health needs and not everyone's embracing the telehealth piece. So that's a bit of a struggle, is to try to balance the needs and get the behavioral health. We've had to do creative things working with Optum, actually, our behavioral health vendor, where they help us find resources. We've had an uptick of 21% behavioral health referrals 6 months since the pandemic started. And we found it's taking us 4 weeks to find a behavioral health specialist that can work with an employee, just because the reduction of the number of behavioral health providers in general. So it's a very tough situation to be in, as we have employees in need, fewer resources. So we're sort of holding on to and taking care of our employees until we can get them with an ongoing provider that can work with them. But we've gotten creative, you know, working with Optum to help us find these resources. And we don't have a copay for behavioral health right now. So that's helped, I think, open up some doors.
Yeah, so shortage of providers I've heard that, you know, anecdotally is a challenge. So the tools that, you know, employers can provide more than ever are important. Any other thoughts, Nikki? Any thoughts on the sort of how has the pandemic, social justice issues made it harder or made it more challenging, or made it easier perhaps to talk about some of these issues?
Definitely made it harder and easier at the same time. The harder is the blurred lines between work and our home. It used to be easy to put our suits on and go to work and be a certain person. Now, people are in my home every day. That's a challenge, but it is also an opportunity to be real and authentic and to say, I'm tired today. I'm just okay. So that blurred line adds to the complexity, but it also allows for those more real conversations when we want to start talking about how we truly feel. And that is the gateway to thinking about help if we need it.
That's a great point, actually, and I never really thought of it that way, is that when people are sort of feeling, so I guess you're right, it is a plus and a minus, because sometimes, right, you put on your sort of armor and you go to work and you believe all those problems or try to leave them behind, even though that's probably not the best solution. But, being able to be more open about it is really important. So taking on to that, we're talking about it. This is the work that you all do. So, it's a comfortable topic for you, but, and maybe someone says, I'm tired, or I'm having challenges, or, then if they're really upset about something, or perhaps they have lost someone they love, so on, things like that. But in general, I think people, particularly, work relationship, people are hesitant to talk about their mental and emotional health. They're really hesitant to say to their boss, how they're feeling today, or, I think, Ken, to hear more about those wellness days, what does that mean? So what are some effective strategies for helping people talk about their mental and emotional health?
One of the best strategies, I think, is giving people the right language. Terry made a great point earlier. Are we debating, is it mental health, behavioral health, is it brain health? And maybe we don't need to be caught up in it. Maybe we just need to encourage people to put words to how they're feeling. And if we think about it in a clinical context, 20 years ago, we said, get a colonoscopy, know your A1C. 20 years ago, did everyone know what an A1C is? And now if you say A1C to anybody, they're like, oh, that's my 3-month, glucose reading over time. And of course, I've had my mammogram. Of course, I've had my colonoscopy. I'm going to tell you about it in the break room. It used to be very taboo to talk about cancer and cancer screenings and a diagnosis of diabetes. And we've spent a lot of time in the healthcare industry taking away that stigma. So we have the language, fitness, healthy eating, rest for our medical health. So what about our language for behavioral health? How do we describe anxiety, stress, depression, grief, PTSD? You've never believed it could happen to you. So I think starting with that education and literacy opens the door to remove that hesitancy. And it may be as simple as I'm not okay, but giving more of that language is a good starting point.
Absolutely. Other thoughts on what are some of the great strategies to help people talk about this?
I think we also need to educate our managers on frontline as well as leaders. And I think there's more of a transition to trauma-informed leadership, and sort of looking at, the emotional safety, the connection, the collaboration that employees and we all need in the workplace. And how do we support those discussions with managers, and recognizing that job performance, when impacted, often relates to personal concerns. As Nikki was talking about, the children in the background as you're trying to work, where you used to be able to put your suit on and go to work, is so hard for some of our employees. So I think, again, educating managers to have an eye out for that and to be able to support their employees in those ways, I think will make a big difference.
I think that's huge. Keith, I see you shaking your head. To talk a little bit about maybe sort of what the strategies to help people talk about it. But if anyone also wants to shift to the question about helping managers to recognize and address that. So go ahead, Keith.
Yeah, I agree with both Nikki and Allison around education, information, and support for managers. One of the things that we are extremely conscious of is the idea of personal brand impact. That's one of the things that causes folks to not want to speak up about mental health within the workplace, for fear that their personal brand would be damaged as a result of sharing. And what we try to do is create environments where that's not the case. And you do that through educating employees, educating managers, giving them forums so that they can have courageous conversations around mental health in safe environments where people don't feel as if what they're being said will be used against them, right? People don't want to have a situation where a manager may have a negative perception around something that they're dealing with, and creating an environment of acceptance around that and giving people the tools and education and knowledge they need to be effective in supporting others is what I would recommend for folks to try to think about when they're thinking about supporting employees.
Absolutely. Ken, what are your thoughts on that?
You want the employee to lead with this. You don't want managers making clinical assessments of any kind. You want the manager to create a space. About 4 years ago, I ran an event where 4 people who were in recovery from substance use disorders gave talks. The CEO led it off. I hosted it. All the managers and colleagues of theirs attended. It was a beautiful event, actually. It's my single favorite 2.5-hour event in my run at Blue Cross. 3 people sent me emails the following day. I've been in recovery here for 17 years. Today is the first day I feel that I belong. Because I went to the event last night. You said, okay. So what does that mean? What means something happened in the culture? And again, I'm not saying that's easy to do. I'm not saying every place would be appropriate to take it on, but we've been taking a lead in making it harder to overprescribe opiates, eliminating the copay, the deductible for methadone, eliminating the copay for Narcan. We've been on the addiction space. So I wanted to do this, and it turned out there was a group of people who were having the same thought. Why don't we take our experience and share it with our colleagues? So it didn't come from me, it came with me, but it was a proud day for me because I felt like the culture changed where people felt that it was okay to talk about.
Definitely an effective way. Terry.
That's in line with what I was going to say too. I mean, I think it's one thing to say, oh, employees should feel free to share, or we don't want them to feel biased against, but we're part of that, right? Us sharing our journey, us not putting on the armor to, work through a day when you're not feeling yourself, us being open and honest. Well, that's what's going to help our employees, our staff, our leadership, see that that's appropriate. It's not only acceptable, it's appropriate. It's what we should be doing to get us past the stigma and to make sure that we're making, holistic decisions for our population, our constituents, our family, everyone we come in contact with.
Absolutely. Other thoughts on that in terms of how can you help managers recognize the signs of stress, and how do you help them address some of those issues just, on a day-to-day basis?
It's important for managers to practice their noticing skills. And we're talking about things that we cannot measure or weigh, but something like anxiety or stress or tension or energy level in your team is something palpable. When someone you've been working with, if I've worked with Keith for 20 years and I know his energy level, in the past 5 months, his energy level is different. As a leader, I should notice. And it is a good time to maybe even include it in an employee survey. Our organization has surveys we put out periodically. Typically, it's surrounding, how effective is our work environment. This year, there were very pointed questions about mental health, stress, and our feeling of being overwhelmed. And I have not seen it in 10 years working at Optum and United Health Group. So they are looking at me and saying, are you okay? Can you tell me? And even if maybe I'm saying I'm more okay, the fact that they're asking the question as leaders changes how I feel about my organization.
Okay, Keith?
Yeah, I agree. I think when you're thinking about managers, the idea of emotional intelligence is very important. Having those opportunities to connect with your employees, listen to your employees, right? To Ken's point around, we don't want managers giving clinical advice, agreed. However, there are opportunities for managers to just say, how are you doing today? Connect in that personal way. If you know that your colleague has children, how's that school going at home? Ask those real personal questions that create those connections that allow people to feel as if it's okay to talk about these things in the workplace. It's okay for me to bring my personal into a work environment and have that be accepted. So I think that managers need to start focusing on that skill of emotional intelligence and really create those connections with their employees to again create that culture and that environment where we are combating the stigmas around mental health.
Absolutely. Allison?
Yeah, I just want to make a plug for managers. I know in the whole last 13 months, the managers are stuck in the middle with trying to support their employees and reporting to leadership and taking care of our patients in our system. And so it's been an incredible journey for them. So I just want to sort of acknowledge that. And I agree that we're not asking managers to diagnose. We're asking managers to be aware and conscious and to be present to employees and to know the resources. And I think there are lots of models out there for employee to employee, which I think is what Ken was alluding to, and sort of peer recovery. But there are peer support programs for clinician to clinician. We have buddy programs in our system. The Brigham's about to start a RISE program for when an event occurs, how to reach out colleague to colleague. So I think we need to I think it was Ken said, get creative. What works for your system? And the EAP had an initiative just before COVID called Are You Okay? And it sort of looks at how an employee can recognize in their colleague, maybe when they're not okay, and how to have that discussion or dialogue with them. And that program that we created, our chief HR officer, Rose Sheehan, created a video describing it and talked about her personal experience. And it was so powerful to have a leader talk about how depression and anxiety impacted her. So I think, again, it's all levels of the organization, and we need to find ways that our own personal organizations, what their needs are and what they could benefit from, what programs.
Great point. Other comments on that?
The only thing I'd add is we do a lot of work helping employers of all sizes with manager training on various topics. And even though our focus here is mental health, I mean, this manager awareness is really important across all different kinds of things related to, human capital management. I think about folks that have employees out on disabilities. We all know that folks who have disabilities are much more likely to also have a mental health issue at the same time. And, it's important to get managers having these similar conversations, or again, just creating a safe space, asking the question of how someone is, to see if there's other things they need to consider related to employer compliance, things like the Americans with Disabilities Act, things like FMLA. So I know in some ways those feel like a completely different purview, but it's that same openness, to say to an employee who's been a great performer, is there a reason you're having trouble getting to work? We're not suggesting they sit down and say, are you having a mental health crisis? But, is there a reason that you're not performing the way you expected? Is there something that's causing constraints in you being able to get this job done? Just opening up that dialogue. A piece of it is mental health, but it's also really just managing the population and doing the right thing.
Great point. Let's talk a little bit about, each of you have talked about different things that you're doing or that you provide, tools, the tools that you provide for employees to manage their emotional health. So if you could share again a little bit more about some of the tools that you provide as organizations, both within your organization, perhaps to those of you in the healthcare space, to companies that you work with. What are some tools that employees can use to manage their emotional health? And perhaps someone might also touch on, this was a question from our audience, how could a small employer, you all work for large employers, but also you have smaller employers as your sort of constituents, if you will, how some ways that many small organizations who don't have those resources, what are some of the things that they can do to help their employees as well? So talk about the tools for employees and both on sort of large and small scale.
Historically, we've started the conversation with EAP. EAP is a fabulous program for support and even that concierge work life, finding a babysitter, finding someone to help with your lawn care. But now we've gone even further when we think about a continuum of care. Maybe someone doesn't quite need EAP, but they need some education or self-care strategy. So it is Mental Health Month. Organizations like Psych Hub produce these videos. You could just watch them on your own time. There's no cost to them. Or apps. There are beautiful behavioral health apps out there, meditations, mindfulness, cognitive behavioral therapy. We partner with Sanvello, but I tell everyone the best app is the one you use. And if it is a celebrity reading you a bedtime story and you love it, and use it. Virtual care is a tool. It is, not everyone is receptive to it, but it is changing the way we deliver care.
Mhm.
That is a wonderful tool. So thinking about telephonic, audio, texting capabilities to still receive clinical care. And then a funny thing called interacting with humans, which is calling your health plan. There are people, humans who still answer the phone and who can help you. So self-care and self-guided is incredible.
Mhm.
But because we've had such an unusual year, I tell people, call the number on the back of your insurance card. There's somebody who could help you, who can speak with you, encourage you. So there are many tools out there, and for small organizations, utilizing what's available, easy access videos and webinars on mental health, putting maybe a line in any communication. If you have a newsletter or a stand-up team meeting, it doesn't have to be an hour-long lunch and learn about anxiety and depression in clinical care. It can just be, have you taken time to take care of yourself today? And that could be walk, healthy eating. So tips along the way that aren't, don't feel oppressive or like a clinical diagnosis, but just kind of a way to coach us every day.
Absolutely. Ken, Ken, want to talk a little bit about some of the tools that you've found effective?
I do want to make a comment as the clinician on the panel. People ask me, is telehealth as good as in person? And we knew for years that it is considered as effective and safe, and actually in a pandemic safer. But it was essentially a country back road that nobody took. It's now a 16-lane highway. And the American mental health system, which has never been accused of fast action, pivoted within about 4 days. And I know several clinicians who've given up their offices, and they're not going back to paying for rent. The no-show rate is virtually zero. This is universally reported, so the clinicians get something out of it, and in addition to saving their commute, people no longer have to drive, park, and pay. So, and the phone sessions speak to an equity issue for people who don't have either privacy or the internet, and so that's an important development as well. The small employers have the advantage of being able to control your culture. And I think culture is, again, the most important variable in this entire equation. So you know people personally, you're a leader, you can set a tone. And once you have a larger organization, I think culture, it gets a little more complicated because of the number of players involved. But there's a half a dozen online learning processes that are based on cognitive behavioral coaching. And they're all the same. I'm sure I'm offending someone who works for one of them. They all take the idea that you don't believe your thoughts, you notice your thoughts. Your automatic negative thoughts are not actually you. They're automatic negative thoughts. So you critique your experience, and this is the essence of kind of cognitive behavioral therapy. This is not therapy. This is a coaching app that's self-winding. But I think a lot of people use it. I'm surprised more people use it than I thought would in the Blue Cross world, because I think people are struggling in cases and are just looking for ways to boost their own resilience. So I think that, they don't necessarily want to join I have a mental health problem, but they do want support because it's a difficult time for a lot of people. So that is a resource. They're not incredibly expensive.
Yeah.
But they all rely on similar constructs.
There are a lot of resources out there. Keith, want to talk a little bit about what tools do you feel, have been effective?
Yeah, I agree with what we've heard here from my colleagues on the panel here. EAP has been extremely helpful for us in actually promoting it. What we found is that many employees are not aware of the program and all of the many components of it. So really having an opportunity and having a directed approach to making sure that folks have awareness around what's available to them is one thing. And I'd also like to say that thinking about and I think I can use this loosely, the low hanging fruit that we could look at to really support people. And when I say that, I mean, stating things like folks thinking about not having meetings during lunchtime, thinking about reducing screen time, having a policy where folks maybe shift from a virtual meeting to just a phone meeting, right? Remember, we used to have phone meetings back in the day. Really thinking about those things that can impact people directly, that don't have terribly consequential operational or cost impacts, right? allowing your employees to take time off in the morning to go take their children to school and being very prescribed about that. Managers can actually say, hey, I know you got children, go out, do what you need to do in the morning and we'll set meetings at 10 o'clock. So really being diligent about ways that you can support people in the way that they live, in the way that they are functioning, and the things that they need in their personal lives is one way to really think about how you can support people, right? Think about those small things that are impacting us all.
Absolutely. Allison, were you going to say something? You look like you were going to talk. No?
No, but I'm looking at all the chats about what is an EAP. So
I know, I was just going to bring that up.
So, I mean, an employee assistance program basically supports the employee in any behavioral health needs, and each EAP, depending on what your employer has, offers different resources. So we have childcare, we have elder care, we have financial and legal resources within our EAP, but we're one of a few still internal EAPs. We are employees of Mass General Brigham, and we work with our employees to assess what their needs are, be that are they safe at home, or is there risk for a harm to self. So we'll do a very thorough behavioral health assessment and get the employee the resources that they need to support them. And sometimes, as I said earlier, we'll take care of our employees until we can get them to the long-term care that they might need. And we do things like when there's a trauma in the workplace, we meet with the teams that are impacted, and we do lots of work-life webinars, as I mentioned, about grief and anxiety. So that's part of the core services of what an EAP offers. So I couldn't help but notice all those questions coming in and respond.
I actually saw that just as Keith was talking, I was looking at the chat as well. So thank you for pointing that out. This is actually a comment that someone put in the chat, and I thought it might be just a good a topic for really discussion. Is that this person cites the problem with managers observing the well-being of their team, as you mentioned, asking those questions, how are you doing, whatever. Is that stress levels, observing stress? It's subjective, and if the manager herself or himself is stressed, they may not be able to see that in others or even in themselves. Anybody want to just sort of address that comment in general? Like, what do you feel about that, or what thoughts do you have on that? Terry, you want to start with that?
Sure. I mean, I think that's true. All of so much of what's in the mental health identification space is subjective, and certainly our managers don't have the training to necessarily do a great assessment, but I think they are the individual that sees them most frequently at the employer site. So hopefully they'll be able to notice at least changes in that individual, performance related, attendance related. So, I completely understand that it's going to be subjective. I mean, one thing that you could do if that's a large concern, or if you have a lot of managers to kind of corral and talk about with this issue, is maybe give them a barometer, give them kind of a few questions to kind of track with. But I think it's a valid complaint, but I don't think it should be enough to dissuade us from educating managers about, having an open dialogue with employees and creating a safe space. I just think, managers aren't the only thing. Nikki talked about all of the resources that you want to make available to folks. And I think a piece of that is making sure your culture with managers is supportive, but certainly that's not the only option that employees should have as a way to get treatment or care.
And I would add, managers should start with themselves, and that's part of this conversation today. It would be great for me to give some tips and suggestions for mental health and navigating the healthcare system to all of you if I have not done the work myself. And so for any of us listening, how are we feeling? What have we noticed about our mental health this year? Then I can help my team. It is just too easy to say, I went to a webinar, I heard everybody was stressed, now let's talk about it. But how are we starting with that vulnerable conversation? And I like the earlier point from Ken about employees bringing things forward. Well, managers need to bring themselves forward into the conversation as well. Help ourselves take care of our emotional health, and then look out towards our employee populations.
Excellent point. Keith, Ken, thoughts on that?
I agree wholeheartedly with Nikki and Terry. One of the things that how we frame that whole concept of taking care of yourself is the idea of when you're taking a flight, when the attendant does that whole thing with the mask, they tell you to put yours on first before you help someone else. And that same idea applies here when you're thinking about supporting others, when you're talking about mental health. Put your mask on first and deal with your own stuff and make sure that you're taking care of yourself, and then you can help others.
Absolutely. Ken, comments on that?
I agree with Nikki and Keith.
Yeah. All right. Perfect. Excellent. We talked about the employee assistance programs, or EAP, and thank you for defining that. There are so many tools in that, and I think that that, like you said, just having conversations like today hopefully will encourage people, whether you're employees, managers, or even those sort of at the very top, to look at that EAP and remember to suggest that to your staff, if to have them look at all the resources that are there. Oftentimes it's you start a job and they say, hey, we have an EAP, and no one really takes the time to look at it. So I think that's really important. How about one of the I'm just hang on one second. A question that someone had posed is this person mentions that they've been leading workshops about wellness across the country. So and they've said that they've noticed the success of the program is only as good as the leadership and the corporate culture, and people do talk differently about mental health in different ways, and sometimes in front of the team, sometimes behind closed doors. How do you handle people? Any tips sort of on sort of at the leadership level? What are some of the additional things they can do to build a good culture that really incorporates that mental health or wellness piece into the conversation?
I think to Ken's point earlier, if you can get your leadership to tell their story in some type of appropriate, forum, if that makes sense, when that makes sense, everyone has some type of mental health story, whether it's for themselves or how they've been impacted by someone they're close to. So I think that can be a quick way to help, light a little fire and to change corporate culture. But at the same time, I think some of this is doing the work and slowly over time making change. I mean, the other thing I'd add in is that the decisions we make and our leaders make set some of the culture. So people were talking about employee assistance programs or health plans or digital tools, making those things available, not making fewer barriers to people getting access. That's also slowly changing the corporate culture to let people know they can access as it's appropriate. Keith's mentioned about being more flexible, giving people time to drop kids off at school, taking lunch breaks. That's showing through corporate culture. So I think there's a lot of things that we can do, baby steps, but I also think having leaders tell their story can be one. And the only other thing I wanted to add too is I know EAPs are a big, strong thing that employers leverage for behavioral health. And I'm a fan of EAPs as well, but historically EAPs have only had, a handful of visits in them. And sometimes, even something as simple as that, revising your EAP plan design to be a bit more robust. Sometimes people might dip their toe into mental health services, get their 3 visits, and then say, all right, well, my company's only paying for 3, so I'm done. That's just when they need to keep going, right? They've realized where their issues are. So having a program like that can sometimes do a little bit of a disservice, because just when they've started getting comfortable and wanting to do something to take better care of themselves, they feel cut off. And then we go back to where we started, the stigma, the access, the cost. So I think all of those things, the holistic approach, the plan design, telling their story, are what will slowly kind of change corporate culture and trickle down to manager culture as well.
Yeah. Let's talk for a minute about return to work. That's now more and more we're hearing. Some of you are already partially at work. Some of you have been at work, depending on your profession. But we're talking about this return to work, in the state of Massachusetts and across the country. Now everyone's saying, okay, as of X date, boom, it's back to normal, right? So that's also going to be a stressor for many people, right? So that will also cause, sort of another level of I think, mental health issues or stresses. And so can you talk a little bit about that? How will you, number one, what do you think the needs or the challenges will be for both employees, employers, managers in addressing sort of the whole anxiety of the return to work? And then given the fact that, we're talking about mental health now, how do we ensure that, the mental health aspect continues as we hopefully find our way out of this pandemic and getting sort of back to life as normal, that we don't just sort of forget about it now that, okay, we're back to normal. It's kind of a long question, but love to hear your thoughts. Nikki, you're laughing, so I'll put you first.
I'll start. I'm smiling because great questions for return to work. It's who needs to return and when and how does that impact them? Some of us have really enjoyed being in our home environments to work. Others of us are ready to return to work emotionally. So everyone hasn't had the same COVID experience of staying at home and staying away from work. So just being mindful of how that transition might be different for different people, working parents whose kids may still be in unique environments, and then crafting a return to work plan that acknowledges and honors everyone's different experience. So I think, that's an important step when we're thinking about the return to work, and that it is going to create some anxiety among people. Even just our social norms have shifted, the way we used to go to and from the break room and the cafeteria, and we're going to have to relearn how to interact in group settings, and that will have a mental impact, even if we're quite excited to return to work. So there are lots of things along the way, and continuing the mental health conversation after return to work. Yes, we can say a specific date. This is the date the world returns to normal. Well, was it normal before? I don't know. So how do we include behavioral health in our medical conversations and integrated conversation when we're talking about wellness and clinical care and behavioral health? They should all be included together. So it's not just this year we're focusing on mental health because of all the social justice and pandemic conversations. And then next year when it's normal, we don't. We're going to always need to talk about this. And we're always going to ask you to have your colonoscopy. So, right, those medical and behavioral conversations should stay together into the future.
Other thoughts on that, the remote work, return to work, how that's going to impact it, and keeping mental health top of the conversation.
If you have the courage to hear the answers, talk to your employees. They're likely to want flexibility, some choice. Their lives have been overturned. People report that their kids are doing better. That's not common, but I've had many people tell me that, because the assumption is, school from home has been harder on all kids, and it's been hard on most kids. So if you're going to ask about flexibility, be prepared for a flexible response. And I would also acknowledge that a lot of people have struggled through this and had some burnout. LinkedIn gave their employees a week off, and it's very well publicized and a brilliant PR move, but also an acknowledgement. It's been a very difficult time. And the leadership probably didn't share their own personal story. They just said, I see you. I see what you're going through. We're going to pay for a week off, no questions asked. Nobody's going to be sending you emails because they're all off. And so I think, you can make some acknowledgement of the fact that people have had major adjustments, making some negative human life experiences along this way. A lot of people have gotten sick. A lot of people have died. A lot of people have not been able to grieve normally. It's been a very difficult time for a lot of people. So I would say, acknowledge that, ask your employees if you have the courage to actually hear their answer, and think about acknowledging mental health and burnout through this experience as part of your plan.
Absolutely.
Yeah, I just add that I encourage folks to think about how they re-enter the workforce, right? We've had a year to kind of test, so to speak, this whole idea of remote working. There were some reservations about that, right? At least in my own company, we were thinking maybe this might have some disruptions to our business operations. But we found the exact opposite. We found that it was fine, that the world didn't end when everybody was home working remotely. We found that we were quite efficient and effective from working home. So thinking about how people need to enter back into the work, because you got folks who have done really well being home and working. And then you have others who have not done as well, right? Who are craving that in-office interaction, craving that opportunity to have that commute, to drive back to work, to drive to work, right? Listening to their NPR. So being conscious of what people need, to Ken's point, listening, and understanding that we should have some flexibility as people transition back into the workplace. Maybe it's coming up with schedules that stagger people to come back into the office. Maybe there's opportunities where everyone's in the office at the same time, right? To start to build that community, but really being descriptive about how people reenter, what their needs are, and understanding that flexibility will be key when you're thinking about reentry.
Totally true. Allison or Terry, any other thoughts?
One of the things that someone said to me a few months ago was our terminology. So I've tried to shift from return to work to return to site because everyone's working, right? So that was just like a reframe for me. But I mean, I sort of with what Nikki was saying was don't assume, I heard her in terms of what we expect employees might want. They might really want to come back to work, or they might, prefer to work remotely. And as Ken said, I think is to think about asking. And when you ask, you might not get the answer that you're looking for. So flexibility, I do think, is the key. And being able to hear what the employees want and whether or not you can actually, accommodate that becomes another issue. And so I know if we're talking about September, a return to site, and that takes care of the childcare summer care program issues, right? So a lot of the summer care programs, aren't activated, so that might help with that. But what I've learned in this pandemic is where we would plan months and months ahead of all of our programming, we just follow the wave when it hits us. So like you have to plan a few months in advance, but we'll be facing a hopefully not variant at that time, when we're looking at return to site. And so how do we have to adjust based on what's going on with COVID-19? So flexibility, I think, is kind of the key, and it creates stress in and of itself.
Definitely.
Can I just jump on that point that Allison made about reframing return to work or reentry to work? I totally agree. And I think for me, the idea of reentry has a different connotation when I think about it, from at least as a DE&I or diversity, equity, inclusion practitioner. I think when I hear reentry, it makes me think around folks returning to a society from the penal system, right? That whole idea of reentry. So I just wanted to co-sign Allison with reframing that to maybe return to office or return to work.
Totally agree. If I can, and maybe Terry, I'm going to start with you just on this question, and then we're almost getting to the end of our time, believe it or not. So I would like to end with maybe, and we can be thinking about this, just sort of like, let's take it sort of individually, and tips that you can give people for self-care. What should we all be doing as people, as human beings now in this time, whether it relates to work or not. But I mentioned that one of the things I think that will be really important is keeping this topic of mental health top of mind, and things like that we're talking about EAP. People don't even know what that means that probably their employers aren't talking about it. So keeping mental health top of mind, because it really is the whole person that is the key to success of any organization. And someone posed the question, and I'm just going to read what they wrote. They said, it's also the question of looking at the cause of stressors. Are companies willing to make changes in their culture and make real change instead of sort of saying, sure, we're working on it. This person mentions that we now have the opportunity to step into a better world, and consistency on this topic is important. And I think that's really true. In some ways, a lot of these issues, we talk about, ask your employees how they're feeling, but perhaps sometimes people don't want to say that because of job performance issues, stress at people just aren't going to want to talk about that because perhaps, or their managers might be, saying they're not performing, but they don't look at it as a mental health issue, et cetera. So how do we, either change the culture, how do we make sure that we keep it top of mind, and sort of do a culture shift to make sure that, look, work is stressful, business is stressful. It's going to be even more so for many companies, that had to lay people off and whatnot. What are some things that you think, or you've had success with, that companies can do to kind of shift that culture to make sure we're creating a holistic environment for people?
Yeah, I mean, again, I don't think there's any wonder pill that we can just say, do these 5 things and you're going to shift your culture. But I do think all the things we've been mentioning are creating a safer space. I do not think this discussion about mental health, behavioral health is going away. I think, it's out of the cage, right? You can't get it back in, which is a great thing. We've been for years wanting to have more open dialogue. And I think we've really been pushed and forced to have it because of the pandemic. And I think that's wonderful news, where we started this dialogue, an hour and change ago, saying those are some of the silver linings. I truly believe that. So I don't think this mental health dialogue is going to go away, and I don't think it should. I think we'll do an even better job figuring out what are the right definitions. I've always struggled with this idea that mental health is one topic we talk about, and then physical health is another topic we talk about. And I think everyone on this call would agree it's not that at all. It's a Venn diagram that overlaps pretty significantly. So, but I understand also the need to have some terminology that clearly differentiates between behavioral health issues and other physical issues. But I think really the key for me, I'm completely provider agnostic in terms of what plans people should have, what tools people should have. The goal for me is to really say, think holistically about what you want to give people. This is not something, in my opinion, where you want to splatter everything against the wall and figure out, let's offer them 20 different options. Because I think sometimes when you're in a space where you're having difficulty deciding what's the way to reduce stigma, get access, reduce costs, that's like too much choice. I think really the key is to think about what kind of ecosystem for overall health do you as an employer want to have, your health plan, maybe your EAP, maybe a virtual solution, whatever it is, and then really work towards promoting that. If you want to move to alter your culture and you want to say, we're going to do roundtables, we're going to do manager training, then set a plan and stick to it and make it holistic. It doesn't have to be an hour session about mental health care or, what solutions you have. It can just be about what your offerings are. So I guess I was a little bit towards your question, not exactly aligned to exactly what you asked, but I think the key is this discussion isn't going away. To me, the goal is to really develop some solutions and stick with it. I'll use an analogy for me. I've been talking about losing weight and getting healthy for years, and since I had children. And I've had everything, right? I've had access to gyms, I've had access to apps, and I just haven't done it because there's been just barriers in my way. And I joined a group that was very prescriptive. It was like, okay, you have to do these fitness things every week or you're off the team. Now, who cares if I'm on the team? I don't really care if I'm on the team, but I got assigned a team and I don't want to let my team down. So, for the last, 3 to 4 months, I've been doing these exercises and these various things, checking off every box because I don't want to let myself down. I don't want to let my team down. So it's not it's an analogy to say, if you give people a prescriptive route, whether it's your ecosystem, your health plan, your virtual solution, whatever it is, I think a lot of people will really do their best to embrace it. But sometimes, especially with folks struggling with mental health, too much choice can be a burden. So I think it's nice to give enough tools, but also give people, a prescriptive approach to get the information they need, get the access they need. And again, I don't need to repeat all the things my wonderful colleagues have said. We've kind of laid all that out, but I think really it's just digging in and getting the work done.
Yeah, definitely. We're coming along our time, which I can't believe. There's so much we could talk about, and you have all been amazing. So I'd love to sort of do a quick speed round, and let's see, I'm going to just go in the order on my screen. So I'm going to start with Ken. Quick speed round is just maybe give us 2 or 3 things that you would want to share with this group about what we each can do to sort of, keep our mental health in place on a regular basis. Ken?
As an employer leader, remember that the culture has changed, the world has changed, and people will be interested in mental health. And so in terms of turnover and best business practices, attending to this is going to be important. The basics, exercise, being outside, connecting with humans in creative ways. I treat media like espresso after 3 o'clock, no contact with media at all. All the bad news will be there for me.
Great. Excellent.
And, again, this is a creativity element. Find what works for you and stick with it. Create a routine if you can, and then break the routine as you need to.
Outstanding. Allison?
Yeah, I'm going back to an earlier question about what can small businesses do. So I think, as Nikki alluded to, there's lots of apps out there and resources that are free. So I think what's really important in small organizations, large organizations, is to get a resource list available and push that out to your employees so that everyone's aware, even how to get a primary care physician in your plan. That's really important as well, integrating behavioral health and physical health. So I think really just getting in front of employees what the resources are. As Nikki said, the best app is the one that you're using. So let's let employees know what the available resources are to them.
Perfect. Keith.
So first I'll say take care of yourself. Take the time to really focus on self-care. Second, I'll say be courageous. In the workplace, be courageous around having these conversations with your manager, with your colleagues, with your friends. That's the way that we start to learn different perspectives and understand people's needs and what's important. And the third thing that I'll say is to continue the dialogue, continue to talk about this. We know that it's Mental Health Month now. This can't be the last conversations, right? We need to continue to have this dialogue and pull it through so that it's not just May that we're thinking about this, that we're thinking about this all year round and really being directed around how we support people.
Perfectly said. Nikki.
When we think about access to care, we need to acknowledge that virtual care is effective. We need to know resources either in our internal organizations or out across the nation. The National Council of Mental Health has mental health first aid training, their mental health ally certifications. We can all be learners. And finally, stay optimistic. Recovery is possible. And we say this always in behavioral health. We can change our outlook and outcome. So stay optimistic.
Perfect. Terry.
I would just say try to figure out what brings you joy and do more of it. Reading, exercising, spending time with your kids, whatever it is, and just be kind to yourself and others.
That's outstanding. A great way to end. I can't tell you, I have gotten personally and professionally so much insight and input and great advice from you all today. And I just know that everyone else out there has as well. I will mention someone just put up a note that they said there's an educational program called in Mass called Recovery Friendly Workplaces. You can Google it. It says it's focused on employees with addiction issues, but has a lot of overlap with a lot of the issues we're dealing with today. So just a resource you can take a look at. I can't thank you all enough. Really, that was just truly outstanding, and just for sharing your personal and professional thoughts. We truly could have continued this conversation. I hope that we've given all of you out there some great tools, both personally for yourself, as a manager, as someone, as an employee, just truly outstanding. So really, thank you, Ken, Keith, Allison, Nikki, and Terry. You've been amazing. I'd like to thank always Health Partners, Blue Cross Blue Shield of Massachusetts, Harvard Pilgrim Tufts Health Plan, Spring Consulting, and United Healthcare, all of you for your partnership again. Use the hashtag BBJ Mental Health to just put some stuff out there. There's been a lot of amazing stuff in the chat. So really, please feel free to continue the conversation. It will not only help you, but should help all of us. So I do hope you've enjoyed the program. Truly hope to see you again at one of our upcoming events. Visit our events page on our website, bostonbusinessjournal.com, for more details and see a full list of our upcoming events. And I guess finally, take care of yourselves. And I think what Terry said at the end is just do what brings you joy, and make sure you have great communication, and don't be afraid to take care of yourself. That's the most important thing. So thank you all so much for attending today. Thanks to our panelists and to our partners. Go out and have a great day, and we'll see you soon. Thank you.